Niger state government has been advised to reconstitute the state primary health care development agency governing board. Addressing newsmen in Mina, the Niger state capital, state primary coordinator healthcare advocacy team PHC South Mr. Kalejai Olusunkomi pleaded with the state governor to exempt the board from the recent dissolution of all boards, agencies and parastatals in the state. Clearview TV's Rosa Wudu has more.
Kalejai also called on the state government to fund, complement and ensure accountability of the state health delivery plan to accomplish universal coverage in the state.
Our intervention covers health system strengthening and intervention through policy advocacy and service provision. In the past 3 years, we have received support from Amaye Nigeria to carry out a PAC system strengthening advocacy intervention in Niger State. In the phase 1 of the project, we advocated for costed minimum service package, MSP, which was achieved. On the phase 2 of the project, we started last year, April. We had 2 advocacy objectives, which are 1, leadership and governance, 2, repositioning. These two objectives are pillars of PAC policy. This project has since achieved one of its intervention targets, while the second is halfway achieved. And it should be noted that our intervention has brought the state to second best state in primary health care advocacy, primary health care development agency (SPCDA) in Nigeria on PAC scorecard 4. As part of the commitment of this coalition, we joined other stakeholders across Africa to commemorate the Day of African Child 2019, because the health of African child, especially that of under 5, is paramount to us. Because 23% of our children still die of preventive diseases. We want to first acknowledge the effort of the state government and all non-state actors across the state and the federal government for the effort in investing in the health sector to meet most special health needs of women and children, despite the competing challenges for resource allocation and implementation at all corners. This coalition is calling on the government of Niger State, under the leadership of His Excellency Al-Haji Dr. Abubakar Sani Bello, to fund, implement and ensure accountability of the state health delivery plan to accomplish universal health coverage in Niger State. Universal health coverage means that all inhabitants of Niger State get quality health services where and when they need them without suffering barriers of location and financial hardship. The Primary Healthcare State Advocacy Team in Niger State is a coalition of civil society, CSOs and media with common goals and focus on improvement of primary health care PAC service in the state. It should be noted that the coalition have also worked with other stakeholders in the state to advocate to state government to inaugurate the State Primary Health Care Governing Board, which was widely celebrated in September 2018, but have suffered a setback as it was affected by mass dissolution of all boards and parastatals in the state during transition.
The governing board, which was inaugurated last September and had the Deputy Governor Ahmed Ketsu as the chairman, had less than 8 months in office before it was dissolved along other boards. Rose Audu, reporting for Clearview Television.